So I was born and raised in El Salvador. That's where I come from. I did my medical school there, and after graduating, I did my pediatrics residency in Cleveland before moving to Boston, where I'm finishing my pediatric neurology specialty. I was always interested in learning how things work, and my father is a physician. I remember when I was young, always asking, why do people get sick? What is the flu? What is cancer? And he always taught me in interesting ways, in a way to learn why the disease processes and things like that. And so that kindled that interest in learning how diseases work and how people get treated and how things get better with medical treatment. And that led me to deciding to pursue medicine as a career. For me, the most complex system in our body is the brain, which is kind of what gives us who we are, our personality, our conscience. It all stems from the brain. And so that's what made me decide eventually to pursue pediatric neurology. My general assessment or the examination starts at the beginning when I'm introducing myself. It's important for me to take into consideration how the patient interacts with me, with the family, how they play. So I'm always taking a keen interest and observation in how they're expressing any sort of deficit that might help me with my diagnosis. I'll always be very interested in also discussing the main problems that the family might be witnessing in the kid, and sort of helping them understand kind of what my thought process is, and why do I think something might be an issue or not, and what do I think the next steps are in terms of diagnosis or treatment if necessary. So that's kind of broad view of how I like to approach. Sometimes when families come to the pediatric neurologist, families are understandably anxious or stressed about something that would be happening with their child. And both the fact of understanding the disease process and also undergoing the treatment journey can help both the patient and the family. So to me, that is very rewarding, and that's one of the things that keep me going. What struck me about Avera was kind of how they emphasize their mission and their objectives in dealing with patients, and that kind of aligned with what I was looking for. I was very interested in making sure that every patient has access to healthcare, to quality healthcare, and I think our interests align in that regard, so that's why I choose Avera. So I enjoy photography, I enjoy reading and writing, soccer, being with family, and traveling.